Hi everyone, this is a video about treating biofilms in the bladder. Just before I jump into the crux of the video, if you don't mind taking a quick second to please like or share or subscribe or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So someone posted a question on one of my other videos asking about essentially how to address biofilms in the bladder. I believe the nature of the video was around trying as best we can to deliver a biofilm disruptor to the area where the biofilms are located. And I think it was talking about ideally using a biofilm disruptor nasal spray if we're trying to treat biofilms in the sinuses, oftentimes related to mold in the sinuses. There could be other critters living in biofilms there as well. And so the question was, for treating the bladder, should it be a biofilm that's instilled into the bladder? So essentially infusing it directly into the bladder through a catheter. So it's a great question, and there are protocols where folks do use bladder installations with various substances. There's a protocol using DMSO bladder insufflations. There's or installations rather. There's a bladder insufflation protocol using ozone that's out there that can be helpful and effective. But at the end of the day, that's quite invasive, and it's really not something that's necessary in my experience. Using oral systemic biofilm disruptors will generally get the job done. Addressing biofilms in the bladder. It is going to take a bit longer because the absorption of biofilm disruptors is not fantastic in the gut. My preferred biofilm disrupting agent to use would be a combination of DMSA, R plus alpha lipoic acid, and bismuth, and the alpha lipoic acid and bismuth need to be combined together in a compounding pharmacy to create this dithiol combination substance that really enhances its biofilm disrupting properties. So not quite enough just to get separate bismuth from the supplement store and separate R plus alpha lipoic acid from the supplement store and take them separately. I mean, one could do that, but it's not going to pack as much of a punch to my understanding. So the R plus alpha lipoic acid is quite well absorbed. Bismuth, absorbed-ish, and then DMSA, to my understanding, has a maximum intestinal absorption of about 20%. So we take the capsules, gets down in the intestinal tract, we absorb about 20%. Let's just say, for argument's sake, we absorb about 20% of that phase 2 biofilm disruptor. Then that 20% that's been absorbed is, of course, into the circulatory system, and some of that's going to get metabolized in the liver pretty quickly, but then some of that is going to escape into the kidneys, and then, of course, kidneys prepare the urine, and then that's going to be excreted through the urine, and so some of that which has been absorbed is going to get into the bladder. So overall, I don't know what the exact percentage is. I'm not aware of any radio-labeled tracking studies that they've done, seeing exactly how much passes here or there in the body, but clinically I can say that enough gets into the bladder where we do see that biofilm disruption happening. So it's a relatively small amount, and yes, if it was easy and non-invasive to do direct bladder installations with the biofilm disrupting agent, that would probably be better, although I kind of say better with air quotes and say better with air quotes in my voice, because I don't know that it would be better, because we want to be really cautious with the rate at which we're breaking down biofilms. In my experience, a lot of folks who have chronic embedded urinary tract infections, interstitial cystitis, that type of thing, when there are biofilms in the bladder, those folks tend to be pretty darn sensitive to things that are, if there's antimicrobial effect happening too quickly. So as we start to release things from the biofilms, we generally want to have antimicrobials in place to kill off whatever comes out of hiding. But if that's happening at too fast of a rate, it can cause some major flares. And I can certainly say that my patients with chronic bladder issues tend to be stereotypically amongst the more sensitive folks in my practice. I don't mean emotionally sensitive. I mean they tend to be more sensitive to the effects of treatments. They can flare more easily. So even if it was easy to work with bladder installations, I would be kind of hesitant around that. Now, taking something like ozone, which does have an antibiofilm effect, it's also anti-inflammatory, promotes tissue healing, induces antioxidant production, et cetera, et cetera. So kind of a different kettle of fish, but it's something where a direct biofilm disruptor being instilled, I'd be pretty concerned about seeing flare-ups happening from that. The oral agents seem to get the job done quite well in my experience. I haven't used it nearly to the same extent as the biofilm disruptor I mentioned combination with the DMSA, the R plus alpha lipoic acid, and bismuth. But another phase 2 biofilm disruptor is silver. I fairly recently posted a video about silver hydrosol, and where it is well absorbed into the circulatory system, and it does have phase 2 biofilm disrupting effects. So that actually is maybe more effective actually at going after biofilms in the bladder. I just haven't really played with it. And again, I just really haven't been dissatisfied with using the other phase 2 biofilm disruptor for chronic bladder biofilms. Sorry, it's been yet another long day. I should start recording these videos at the start of my day when I haven't been seeing patients all day. So the silver would be an option to consider, and I don't know, now that I'm saying it out loud, maybe I'll recommend that the next time that I have a patient, or give them that as an option. Try something a little bit different. So thank you for the question. If anybody has any questions on this topic or on any other topic, please feel free to post in the comment section below, and I will leave it there for now.